Good evening, Fort Belvoir. I'm Colonel Seagraves, the Fort Belvoir Garrison Commander. I'm pleased to join you tonight as we continue our monthly virtual town halls focused on important installation operations, as well as readiness, health, wellness, and community information. Obviously, again tonight we've got Captain Judy, the Director of the Fort Belvoir Community Hospital. Thanks for your continued participation, and I'll turn it over to you for your comments.
All right. Well, thanks so much for having me. I'd like to talk about a couple of important issues tonight that are not COVID related for a change. And the first one is that it's October, which is Breast Cancer Awareness Month. And so COVID-19 hasn't slowed down or delayed breast cancer surveillance or breast care. Anyone who has detected an abnormality on a self-exam should speak with their physician to discuss additional evaluation. Our breast care center remains fully operational and we're seeing new patients, and that's really important because I know a lot of people have really kind of avoided the hospital for a period of time, and we want people to feel safe coming to the hospital and not neglect some of those preventive screenings that they need to do. So let's talk about mammography for a second. The American College of Radiology recommends annual screening mammography beginning at age 40 for women at average risk of breast cancer. For women at high risk of breast cancer, that screening should start at age 30, and that's determining that level of risk is something that folks should discuss with their doctor. Our breast imaging clinic at Fort Belvoir offers a wide range of services, including the recent addition of 3D mammography, which offers our patients superior diagnostic accuracy for the detection of breast cancer. And so for your convenience, we also offer mammography while you wait. So if you're in the hospital for any other reason and you want to come and get a mammogram, ladies can do that. Of course, if you want to make an appointment because you don't want to wait, you're welcome to do that as well. And you can do that by calling our radiology appointment line at 571-231-3224. Again, the number is 571-231-3224. It's option 3, then option 4. So that's it for breast cancer awareness. The other important topic that I want to talk about is flu season. Flu season is upon us, a little bit different than coronavirus, but it's time for that flu vaccine evolution that we do every winter. And so we're hoping to get our beneficiary vaccine sometime in late October, and we'll continue receiving that through December. This year, because people don't want to come to the hospital as much and we want to minimize traffic in the hospital, we're going to hold that community flu vaccine clinic in the community center across from the traffic circle by the hospital over there by the Stay Bridge. Please stay tuned to the flu hotline. That number is 571-231-7777. And of course, our hospital's Facebook page offers a lot of information. If beneficiaries want to get that vaccine prior to when we offer it in November, they're welcome to do that. And they can go to the TRICARE website and look at the different options for going to a TRICARE participating program. Those are my updates for today.
That's it. That was good. So I think it's probably more important this year than ever to, if you don't normally get vaccinated for the flu, this is probably a great year to seriously reconsider that.
Always important to get that flu vaccine, but I think people who have not gotten it before, you're absolutely right. This is the year to really do so.
Yep, great. Thank you. So I'm also joined today by several directors who will address some of the questions from this town hall and previous town halls. Before I get to the overall update, I just want to take a moment and talk about a couple of announcements. So in recent days, it's come to my attention that some individuals are still not wearing the proper cloth face coverings, although I think everybody's at least wearing a face covering, which is certainly a step in the right direction. Today we updated the garrison's policy on cloth face covering requirements, which will become effective tomorrow. In summary, this policy requires all employees and patrons over the age of 2 to wear a cloth face covering when in Fort Belvoir facilities. Face masks with built-in valves are now prohibited for use within Fort Belvoir facilities, and here's an example of the prohibited face mask. However, what many people may not realize is that with built-in valves and the filters air coming into the person wearing it, however, the exfilled air is not filtered. COVID is spread through exhaled air, so wearing a mask with a built-in valve defeats the purpose of wearing that mask. So if you fail to follow the policy, obviously you may be barred from entry into the establishment or lose privileges as a worst-case scenario at that establishment, or be barred from the installation. Again, I don't think there are not any sort of egregious violators of this policy, but we did want to update it. A couple of people have brought that to our attention, so I think that's a prudent update as we continue to fight through the COVID environment together. A couple other things: the Secretary of Defense, the service secretaries, and our senior military leaders are leading a discussion across our formations, continually focused on people and values. Suicide, domestic abuse, sexual harassment, assault, and discrimination, among other harmful behaviors, challenge our military and erode trust in our formations. Defense Department personnel with ideas on ways to foster a culture of inclusion, dignity, and respect are encouraged to participate in an online survey. To learn more about that survey, we're posting a link about the article. So I think that's a good one for everyone to follow up on. If you don't normally do a survey and you have a good idea, most of our best ideas come from across our formation, so I would encourage you to take a few minutes and do that survey. This is exactly in line with the Chief of Staff of the Army and the Sergeant Major of the Army's. This is my squad campaign and people first priority, so I think that's a good thing in continuing to reinforce our positive culture. So in addition to Breast Cancer Awareness Month, October is also Domestic Violence Awareness Month, and the Belvoir Family Advocacy Program will host virtual activities throughout the month. One easy thing you can do to raise awareness is wear or display a purple ribbon every Thursday in October to show support. If you need help, reach out or contact the Domestic Abuse Victim Advocate, which is a 24-hour hotline. The number will be posted in the comments, and the number, so we're on the same page today, lots of numbers, 703-229-2374. This month is also the National Hispanic Heritage Month, and we celebrate the many contributions that our Hispanic men and women have made and are making to our nation. So that's another one that we want to continue to recognize. And last but not least, for October, something else happens, and that is our U.S. Navy will celebrate its 245th birthday on October 13th. So to Captain Judy and all of the Fort Belvoir sailors, past and present, we wish you a happy early Navy birthday, and thank you for your service to our nation.
Thanks so much.
So, reopening Fort Belvoir. We do remain at a health protection condition Bravo. That has not changed since our last town hall and probably will not for the foreseeable future. What's new since the last town hall? The Vortex Grill at the Bowling Center is offering grab and go, and the Belvoir indoor pool is now open for active duty and first responder lap swimming only. We transitioned that on a weather basis from the outdoor pool to the indoor pool, and I think we probably got that transition at just the right time. There are several questions asking when family members and retirees can use the fitness facilities, so I know we talked about that one. There's a process in the Military District of Washington for reviewing a review panel for opening new services across the National Capital Region, and we also hold a recovery review board inside of Fort Belvoir to open new services. So this is one that's been a much debate and review by our public health officials from the Fort Belvoir Community Hospital and our own emergency management team. I think they've done a great job on sort of starting to figure this out. So good news, we're excited to announce that we will be able to accommodate active duty family members beginning Monday, October 5th at the Graves Fitness Center for 2 sessions during the weekdays and 1 session on the weekend. This is a trial basis to see how this goes. I think that we can do it successfully and safely for the Fort Belvoir community. I think it's important, especially with just with school starting and all the additional stressors that everybody kind of has going on. Plus, it's just great for overall health and fitness. So I'm glad we're able to finally get there. Hopefully this trial session will work out, and we hope to eventually expand the hours and days of activities. The 2 sessions for family members will be Monday through Friday from 10:15 to 11:30 and 12:15 to 13:30. And then on Saturday and Sunday from 9:15 to 10:30. Active duty and first responders will be able to enter for the first 15 minutes of each session to ensure they are given priority. The sports and fitness teams continuously monitor usage and will immediately look at how we can continue to expand services, as I sort of already spoke about. So for complete details on this, you can go to the DFMWR website at belvoir.armymwr.mil, and that'll give you the details if you didn't catch it during an announcement. That's just one way that we're trying to support and continue to open services safely through our sort of extensive reviews. But most of that really is due to the emergency management team and the help of your team in the hospital. The public health emergency officer is exceptional, Colonel Mabey, and she's done fantastic work for us over the past several months. So we appreciate that support. Another announcement I'd like to talk about, and I think that this already went out through the village mayor in Doe Creek, and potentially went out through the Michael's one-call system that they use to inform residents of changes, and that's the Doe Creek Bridge. So I know we've had some questions about that, and I just want to sort of give you some fast facts on the Doe Creek Bridge. So that is estimated to be completed by July 31st, so that's next summer, under a year away, which is a long time, longer than we initially thought, but that's just sort of, that's the reality of where we're at. So that opening will coincide with the reopening of Walker Gate, and we'll provide more updates once the project begins. Just for a little bit more granularity, that's a $3.8 million project. The contract has been awarded, and the contractor has been given the notice to proceed. So through the Corps of Engineers, they're working on finishing that up, and we'll get it out to us. If it happens earlier, then I think that'll just be a benefit to everybody, but if not, then we have a set of realistic expectations as we collectively move forward. School updates. So through the end of October, Fairfax County Schools will continue conducting bus routes in preparation for a potential return to school after the first quarter of distance learning. Increased bus activity is still expected to continue on Fort Belvoir. I don't think it's been terrible, but I think there has been some on Fort Belvoir, just as we keep the routes fresh and the drivers qualified through all the things that they have to do to maintain their currency. And then finally, a curbside breakfast and lunch options continue for all students at Fort Belvoir's upper elementary. They've got a great system over there, again, very safe and set up and reviewed by the Recovery Review Board. So I think it's a great asset that we have. Playgrounds is another topic that we talked about during the last town hall, and has been a topic of much conversation lately. So the villages of Belvoir has reopened 10 playgrounds following inspections by their certified playground safety inspector. The villages are going to continue to assess all playgrounds and expect to reopen more in a phased approach. They are working on that very diligently and want to make sure that they provide safe and secure places for our children to play. For the Halloween update, so another hot topic. We got lots of topics in October to talk about. So the CDC and Virginia Department of Health have issued seasonal activity guidelines. We are working closely with MDW, the Military District of Washington, and our surrounding jurisdictions to plan for how this will impact trick-or-treat activities on Fort Belvoir. I don't have the final details today. We do have some options, and again, those are going through those recovery review board to make sure that we arrive at the correct decision for Fort Belvoir and our families and those of us that utilize Fort Belvoir for many services. In the meantime, I'd encourage all families to review the CDC and Virginia Department of Health guidance to better understand the risks associated with some activities, and we'll provide updates on our website and social media as we continue to sort of make decisions and move forward for Halloween. So I think now we'll address some of your questions from the last town hall with our subject matter experts. I've got a couple up front before we bring up our first SME. So these are two housing related questions, and so always a hot topic for us on Fort Belvoir, and our responsibility collectively between our RCI partner and the Army is to provide safe and secure housing for our residents. So the question was, the Secretary of the Army stated that they took their eye off the ball and failed families in military housing. What will your office do to ensure the ball isn't dropped on Belvoir and families have safe and healthy homes? So that's a good question, and I think it's important for everybody to understand that the Army housing campaign is exactly that. It's a campaign, not just a skirmish that we solve one problem and move on to the next topic. This is going to be an ongoing phased approach for housing, not just for us, but for the Army across all its installations. The Army and the Department of Defense continue to address concerns across the entirety of the privatized military housing portfolio, and on the ground level, the garrison will continue to address concerns while documenting deficiencies and working with the RCI companies to improve the overall quality of the homes that they deliver to our families while working within the parameters of the RCI program. So again, I think that as we look at this objectively, this is an area where our housing ombudsman in the garrison, our housing office in DPW, and our mayors, both our primary mayors and deputy mayors, are able to assist in housing issues as they come up. The next question is, why should we trust the villages to provide safe parks when they can't provide safe houses? So I touched on this a little bit in the remarks about changes. The RCI playgrounds were inspected and deemed safe by an independent certified playground inspector. Now, at least for now, that's certainly some level of assurance. However, if you notice that something doesn't look right on a particular playground in your neighborhood, you need to let your mayor know about it and call a work order into RCI. They are diligently working on that program, and I think that their communication has gotten much better on announcements for housing. A third question, and then I'm going to hand it over to the director of DFMWR to talk about the bowling alley. This is, are you interested in the systematic HVAC mold problem we have on Belvoir, hundreds of homes? So I'm absolutely interested in that problem, as I am in all of the housing problems on Fort Belvoir. I'm not sure that that's an accurate question in terms of statements. Hundreds, I don't know if that's true, but I'll tell you that I rely on our subject matter experts across the garrison. Some of them I mentioned, but primarily for this one, we have our industrial hygienists and environmental consultants and residents that bring concerns forward so they may be addressed. I'm equally interested in a planned methodology for addressing these issues when they occur, and that's exactly the approach we're taking in the garrison. I think it's important just for expectation management that everyone understand these problems aren't going to be solved overnight. It's a systematic approach by the Army and by the RCI partner to appropriately solve the problems that we have in our housing. George, I'm going to let you talk about the bowling alley and then anything else I missed on the gyms.
Thank you, sir. So as the Colonel said, at the bowling center right now, we currently have grab and go open, and we are currently in the process of putting together a recovery card on open play and league play. Certain conditions have to be met until we open back up in that area, just because of the amount of people and the amount of lanes and the closest that we have there. So that's currently being worked on right now. Some of the other questions that we had within CYS was, what is the status of opening daycares to more than just mission essential personnel? Beginning on July 1st, we began opening up our CDCs to all of our parents that are registered on mcc.com. So that's the first thing I would ask that you do, is to make sure that if you want care in your active duty, especially dual, that you have your kids registered on mcc.com. You should here shortly be receiving a phone call from us offering you care for your child. We also have open our school aid center and our youth center to provide care for those 5 through the age of 12 at SAC and 5th graders at the youth center. So the next question, same as the first, but a follow-on. If they do, will they support the Fairfax County Public School virtual learning? Yes, we are being very successful the last 2 weeks down at SAC, and we're doing well there with the virtual learning. A couple other questions. Are the dog parks open? I know of one dog park, and that's in MWR, and it's currently open down in Tompkins Basin, and it's co-located right next door to outdoor recreation. So yes, it is open. We have to abide by the signage that's down there, the social distancing, wearing your mask if other people are around. Just be safe while you're down there. When will youth sports open? Again, we are currently in the process of putting together a recovery review board card on youth sports to safely open up youth sports camps. The first one that we're going to try is for soccer. We're meticulous in how we approach the opening of our camps. We want everybody to be safe, so we have to make sure that all the different offices on the installation are aware of what we want to do and that we're doing it smartly and that the mitigation risks are in place. So the last thing that I will close with is, if you have any questions concerning MWR, I would ask that you contact us at belvoir.armymwr.com. And if it's for CYS, hit the CYS tab, and that'll lead you to their group box. If it's for recreation, their group box. If it's business, their group box. And any other activity, we'll have an email address there. Other than that, that's all I have. Thank you, sir.
Thanks, George. Okay, the next question is on the gates. Are there any plans to reopen the Beulah Gate or the Lieber Gate, or reopening Pence Gate for 24-hour regress? So we've got my Director of Emergency Services, Mr. Henschel, who's going to answer that question.
Thank you, sir. Sir, as you know, first of all, in regard to the gates, we're constantly monitoring the traffic. We have traffic counters that are out at those gates, monitoring the daily access and egress to all of the gates. And currently, we're not seeing much of a change in any of the volume of traffic that's coming on the installation. We do have plans in place that if that does change, we will make the changes to those gates. But the last portion of that question, sir, was regarding Pence Gate and the 24-hour egress. We have made some changes, and we are able to do that. So we can allow folks to exit the installation through Pence Gate 24 hours a day, 7 days a week, without impacting our staffing, sir. So that was a great question from somebody. We hope you enjoy that, a little bit of benefit. But,
Thanks.
sir, that's my one
It's
question.
open now for 24-hour.
Yes, sir.
Okay,
Absolutely.
good. Yeah, thanks. Okay, so just two quick questions. Can reservists be included into gym access? That was kind of a surprising one for me, but yes, reservists with valid military ID cards can access MWR gym facilities. When can we, the next question is back to CDC. and George covered it a little bit, but it's when can we expect an updated CDC policy based on the updated priority guidelines? So, as George said, I don't know that we're really going to update a policy, but rather we're going to put into place the Secretary of Defense policy that lays out the specific priorities for childcare, which we're working towards. We are still staying within the square footage requirement for COVID. We are still doing, I think it's at least twice daily cleanings by a professional cleaning crew, in addition to what the staff is cleaning. And we're working to hire additional staff in CYS so that we can continue to increase our child care capabilities on Fort Belvoir. It's obviously important now, but I think it's going to become important when we make the official decision to call everyone back to work. That's where we'll sort of get into a really high demand period. So that is all the questions that we have from the last one. I think we've got a couple left over, or a couple that came in today.
Yes, sir. When will Kawamura Fitness Center reopen?
That's a great question. I'm going to hand it over to George, who's coming up to answer now.
So we've got a little bit of bad news concerning that. So Karamora currently is closed due to the closeness of everybody that would be working out in that building. There just isn't enough space. We are currently in the process of renovating Specker Fieldhouse, which gives us 35,000 square feet of usable space. We ran into some snags. There is a delay in construction, so it'll probably be late winter, early spring when we will be opening up Specker Fieldhouse with Karamora inside Specker Fieldhouse. So it's not going to open up anytime soon. It's probably going to be more like 6 months.
Thanks, George.
This question is for the hospital.
Oh, okay, yep.
Can we still drop off civilian paper prescriptions in an envelope at the PX pharmacy?
Yes, that has not changed at all. You still can do that drop-off. That service is available both at the main hospital and at the PX pharmacy.
Good.
So, yeah.
All right, we've got an announcement from our Director of DHR, Mr. Kevin Rennick.
Thank you, sir. Good afternoon, all. I just have an ID card update for you. For those who don't know, on the 8th of September, the Undersecretary of Defense signed a memorandum authorizing further extending the Uniformed Services ID cards, which are the retiree or your dependent ID card, beyond 30 September. The extension goes out until 30 June of 2021. As a result, your benefits will remain in effect in Deers Rapids. However, Common Access cards, or the CAT cards, were not extended beyond 30 September, and in order to service the active duty service members and the civilian workforce of Fort Belvoir, the past 2 weeks, appointments were not made available to ensure that those individuals who had expired CAT cards were able to update and renew their cards. The good news is appointments are now available again. They are available starting this coming Monday, October 5th. But I also want to take this opportunity to say thank you for your patience and your understanding as we continue to process and work through supporting the Fort Belvoir community. Thank you.
Great, thank you, Kevin. Okay, so I think, we've covered some questions that the community had, and I think those are important. We'll continue to do that in these town halls. A lot of times there may not be a really, really good answer that's acceptable to everybody, but I think it's important that we talk objectively about issues that we have and use sort of fact-based decision-making, especially during a pandemic. So I think that was helpful, everyone's announcements, and I appreciate that. In addition to fact-based decision-making on Fort Belvoir, I just want to quickly remind everyone that we have 150 partners, 5,000 dependents, 29,000 retirees, 93,000 retiree dependents, 9,000 military, 19,000 civilians, and 13,000 contractors, for a total of about 216,000 total population supported, in addition to 2,100 homes and over 8,700 acres. So It's a massive undertaking to run the installation in the garrison, and we're doing our best every day to make sure that everyone is getting what they need from us. So I think that's it for now. I encourage everybody to stay up to date with the reopening Fort Belvoir on the Garrison app and the Fort Belvoir website, in addition to the Eagle Facebook and Twitter. And please remember that the coronavirus threat remains high, so just adhere to the current protective measures in all of your activities. Avoid large gatherings, use social distancing, help prevent accidents, and spread through responsible behavior, and lead by example. Until next time, use good social distance, wear your masks, and conduct good personal hygiene. Thank you, and we'll see you next month for our next town hall.